It's better to treat within 6 weeks, because then you can get on the right stretching, icing, medication. Sometimes it requires some injections, that kind of thing. But that's a very common running injury, and you mentioned running.
What are some of the things that the average person, as we always said, people watching TV at home, none of your average, sorry about that, real exceptional, that people can do to take care of their feet? I mean, quite honestly, if this is, because as people get older, they'll complain about their feet all the time. You know, their feet hurt, they can't walk very far, they can't walk very long. So as a person who is, you know, past middle age, what can I do to make sure my feet work for me for the next 20 or 30 or 40 years? What's the best thing people can do to take it? Wear good shoes? Something as simple as that?
Yeah, simple as that. A lot of this is going to be genetic. I mean, and again, flat foot type, high arch, what foot type do you have? So listen to your body.
I have a high rigid arch,
pain is a good indicator of something going wrong.
Okay.
And if you're starting to get some pain, then you need to check it out and see what's going on if you want to take care of your feet. Wear the proper shoes for proper activity.
Don't wear flip-flops if you're going out mowing, right?
Right. Yeah. You know, a little bit.
Flip-flops are bad all the way around.
Well, a little bit goes, you know, don't wear them all the time, then you're going to have a problem.
Crazy shoes right here, they're cute, but there's no arch, there's no anything. Don't wear these for an extended
You're not going to
time.
Silver Dollar City all day.
No, I'm not.
And if you do, you're asking for it.
Exactly.
But diabetics are a big thing. Diabetics really need to stay on top of their feet. I've been here before, and we talked about that.
Yes,
I think your mother is.
But
that is one select population that needs to stay on top of problems like corns or little ulcers, little holes in the skin that form that can get infected, ingrown nails, that kind of thing. Look into diabetic shoes. Medicare will cover diabetic shoes with custom inserts for diabetic patients that have big bunions that are non-surgical, or have you know, a flat pad that's thin and the heel bone is hitting on the floor and they can't walk because they have no fat pad, things like that. That's the population really needs to stay on top of it. But just in general for people, stay active, stretch, wear proper shoes, don't mistreat them with flip-flops and then going 16 hours on a hiking trail.
Right.
I mean, that's just asking for trouble. And then listen to your body. You know, it'll tell you that pain is a gift.
And if there is pain, I'm sure both of you suggest seeking out a physician right away.
Sooner as opposed to later.
Yeah, a lot of things can be treated quickly, like that plantar fasciitis. If I can get people within a month of having pain, I can knock it out pretty much in 4 weeks. If you come in 3 months, 6 months, a year, it's going to take me 4 months, and it's about 80–90% successful. Then you go on to other procedures, which is a newer procedure, which is non-surgical radio frequency nerve ablation of the heel, where you just stick a little needle down to the nerve, numb up the nerve, and then you can heat up the nerve and stop that heel pain. Put a Band-Aid on, you can go. That's an exciting new procedure that I've just picked up in the last year and trained on. So
because people don't, you know, when you have your foot operated on, even if you're just wearing one of those boots, that's real cumbersome, and people don't like to.
Cumbersome.
Cumbersome. You know, it's one of those things. It's like, well, I've got to wear this stupid thing for 6 weeks, and so what you want to do is avoid something like that, right?
Yeah. It's just. People want to walk it off and think it's going to go away, and when it's not responding, you know, people have that internal clock to when they go to the doctor, and some are longer than others, you know. But if you can get in sooner than later, you're going to do yourself a favor with things like that, especially overuse tendonitis, Achilles tendonitis, arch. There's a tendon for a dropped arch called the posterior tibial tendon dysfunction, which is very common for folks when they start dropping down. They get pain in the inside of the ankle right here. That's very common, and you want to treat that aggressively and soon. If you
now,
get
what
some
causes that?
With time, the tendon starts to stretch.
Your
arch drops.
And the arch actually drops down because the tendon is starting to fail. And it's again, it doesn't come right away because you have achy pain there, but you're walking it off, and then you take a Tylenol, and then you leave it alone, and 3 months later, you've got some tendon damage, which now has stretched, and it's not like a rubber band. It won't just come right back and pull your arch back up. So a lot of those, you know, if you get early, you can treat that conservatively and stop from surgery, but late, the tendon tears, then it's surgery. You got to fix it because the arch will drop, the foot will start to dislocate outward, and then you've got ankle pain.
What about the people whose ankles roll?
Exactly.
Is that really what that is?
That's that posterior tibial tendon that has stretched and it's become almost dysfunctional. It's not functioning properly anymore. It can't hold the arch up anymore. And then you just start to shuffle.
Yeah, and they can't walk.
Once you want to pick up pace, you can't. Or you'll get symptoms and it'll slow you back down. And it's insidious. It's slow, and over a course of years, you won't be walking normal anymore.
And
you'll
that's frustrating for you. You see people like that, and there's not much you can do for them. I mean, you can't go.
Well, you see them,
right. You want to run up and go, no.
Yeah. I mean, it's very common to. You're right.
I can fix that.
Well, it's common. People don't realize how they're walking, and after I fix their arch and get them back into proper position, they start going, I didn't know I was walking that way for that long.
Or
now I can walk
it's
faster.
Just old age, or it's just this, or it's just that, and they accept it as something, and it's really not something that has to happen to them. They can fix it and
fix it,
like I said,
brace it, ice it, get it before it becomes degenerative and end stage. Not get there at early stage. If it goes to end stage, then you're looking at surgical. It's like arthritis, the big toe joint. A lot that's common in the big toe joint or the mid arch area. Now, once you get arthritis, you're looking more at surgical.
Now, do you treat arthritis, or do they have
Absolutely.
to go?
No,
you do.
No,
so
I foot and ankle A to Z, so I'll treat it all. I do. It's common for me to do fusions for arthritic joints. Big toe joint is a common one where you get a big lump on the top, not on the side, but on the top, and the toe is locking up and pinching, and it hurts. And that's arthritis. Yeah. So you'll go. I can go in there and fix that. Midfoot arthritis, ankle arthritis, or any joint that you have, the foot or the ankle, can become arthritic.
We're lucky to have this guy.
Oh, absolutely. Absolutely. A lot of communities love their surgical podiatrists for sure.
Everybody will eventually, if they're not careful, probably have some sort of foot problems. People that work, on their feet for years.
1 out of 8 in the population will have a foot problem every year that will require a treatment.
Oh, wow.
Well, and I'm sure, I don't know, maybe I'm speaking out of turn, but I think too, as our population becomes larger, I'm sure that can't be helpful. Yeah. I mean, it can't be helpful.
Yeah, you mean you don't mean larger as in population-wise, but larger as in
as we as humans become larger. Yes, yes, our BMI becomes higher.
Yeah, it's like the obesity epidemic that we've been hearing so much about, which is, I'm not very graceful when I speak sometimes, but that's what I meant. I have a couple of running clinics, and sometimes I have women that come, and they're very large, and they want to try to walk, but literally their feet just roll. I mean, they're just walking on the sides of their feet because. And is that caused by obesity oftentimes, or is that genetic? Where literally they're just rolling and walking along on the outsides of their feet.
3 to 5 times your body weight when you run or walk fast. Yeah, I mean, absolutely.
And that can just cause all kinds
overuse injuries to the tendons. Yeah, once it starts, once you get a little injury to something, then it's just like picking it. Yeah. And then every time you do it, then it gets worse, worse, worse. And again, listen to that pain. You might have to back off, maybe diet a little bit before you start a vigorous exercise program. Maybe so maybe drop a little bit before and then start, and not go pounding right away, because those tendons and muscles and bones and joints are not ready for it yet.
Not ready for it yet.
Yeah.
Okay. We appreciate your time. I know you guys need to get back to work, and I appreciate your time, Dr. Eric and Mike. Thanks so much for coming, and for the continued your support of the Motion Institute. Thank you so much for being here.
Thank you for having us.
That's a big deal in this
Up
town.
next is Wayne Roth and Elaine Ryder from the Baxter County Patriots.
You could read that very well, Daniel.
I can,
Good.
because I heard you say it earlier. Thank you. Stay with us.